Hey, Mid-Decode. Welcome to Mid-Decode.
Yeah.
All right, so let's just set the scene for a second. It's that time of year, the music is on, everything feels joyful, bright. You're thinking about family, big meals, maybe some travel. We're all basically told this is the most wonderful time of the year, a time for peace, for celebration.
That's absolutely the story we tell ourselves. It's the cultural narrative. But, and this is based on decades of just incredibly stark, hard data, there's something we have to share that really flips that whole narrative on its head. Those 2 weeks. The ones right around Christmas and New Year's. They are, statistically speaking, the single deadliest time of the entire year for natural causes of death, especially heart-related deaths.
Hold on, that just sounds, it's completely counterintuitive. You're seriously telling me that based purely on natural mortality stats, I should be more worried about getting sick on December 25th than on, I don't know, a random Tuesday in March.
That is exactly what the data shows. This phenomenon, it's so consistent, so pronounced, and it seems to be independent of the usual seasonal factors. Researchers have actually given it an official name. They call it the holiday effect.
Okay, the holiday effect. We have to unpack this. This is exactly why we do these deep dives. We're going straight to the source material here, a massive study. It analyzed over 53 million U.S. death certificates spanning 26 years. We need to figure out this paradox. Why does joy turn fatal? What's the actual mechanism? And, what does this mean for you and your family during the next holiday season?
Yeah, our mission today is to cut through all the eggnog and the social assumptions. We need to find the specific factors that make this seemingly happy, very short period so disproportionately lethal.
The scale of this problem it's just shocking. When the researchers looked at the charts, just the total daily deaths nationwide year after year, what did they actually see in that 2-week stretch from Christmas into early January?
They saw what they described as twin peaks. And these aren't small bumps. We're talking about 2 incredibly conspicuous, massive spikes in mortality. The study focused specifically on that period from December 25th through January 7th.
And these peaks, they're not subtle at all. They really just jut out sharply above the general winter mortality trend line that's already there.
Absolutely. The first major spike, it's Christmas Day itself, and the second one, just as pronounced, arrives on New Year's Day. If you just isolate deaths from heart disease, those 2 days, they're complete statistical anomalies.
Okay, let's get uncomfortably specific for a minute. If we just look at cardiac deaths, which seems to be the main driver here, what are the top 3 deadliest days of the entire year, and where do they fall?
The rankings are crystal clear, and frankly, they're alarming. Number 1 deadliest day of the year for cardiac death in the U.S. is December 25th, Christmas Day.
Wow.
Number 2, December 26th.
The day after. Okay.
And number 3 is January 1st, New Year's Day. The concentration of this fatal risk into such a small festive window it's just staggering.
And we need to be clear, this isn't some rounding error in the statistics. We were talking about a really significant, unexpected death toll. Over the 26 years they studied, this holiday effect accounted for roughly, 42,000 excess deaths from natural causes?
42,039 to be exact. And to put that number in perspective for you, that's not the total number of people who died. That's the number of people who died from natural causes above and beyond what was statistically expected for that time of year.
And you said this is just natural causes.
Right. We have to be very clear about this. The figure specifically excludes deaths from accidents, from homicide, or suicide. Those were all tracked separately. This is purely unexpected natural mortality. Things like heart attacks or severe respiratory failure.
42,000 unexpected deaths, all concentrated into a 14-day period. We have to figure out the why. I mean, the immediate assumption, the most obvious hypothesis is just, it's winter. Right? Cold weather, it raises blood pressure, it constricts your vessels, increases heart attack risk. It seems totally plausible.
Oh, it is plausible. And that's exactly why December and January are, in general, higher mortality months than, say, June and July. But here's where the research gets really interesting. The study adjusted for that general seasonal trend, and guess what? The spikes persisted. The underlying cold doesn't explain these rapid, sudden double peaks on Christmas and New Year's Day specifically.
And they tested this climate theory in a really brilliant way, didn't they? They look across the entire United States.
That's right. I mean, think about it. If cold weather was the main driver of these specific holiday spikes, you'd logically expect the cardiac risk to go up way more in the freezing northern states, right?
Right, compared to the warm southern states, like down by the Gulf of Mexico. More cold should equal more spike.
But they found the total opposite. The cardiac holiday mortality peak was actually found to be slightly smaller in the colder northern states than it was in the warmer southern states.
No way.
Yes. So this holiday effect, it pervades the entire country, regardless of the local temperature. So we can, I think, safely dismiss climate as the main culprit for these dramatic date-specific spikes.
Okay, so if it's not the cold, what about us? What about our behavior? I'm thinking excessive eating, drinking, just general holiday gluttony,
Yeah.
all that extra stress on the body from, fruitcake and champagne.
Diet and alcohol are definitely not great for you, but the study really undermines them as the primary driver of this massive spike. And the way they did that was by looking at inpatients.
People already in the hospital.
Exactly. These are people who are already hospitalized, often with really strictly regulated diets, very limited access to alcohol.
And what did they find in that inpatient group? Did the spike disappear?
No, that's the thing. They found that even this group, under controlled clinical conditions, also showed a holiday mortality peak. It was a smaller one, but it was still there.
So if the spike was purely about what you ate or drank at the family party, the people already in the hospital wouldn't have that peak.
Precisely. So while bad habits certainly don't help, they just don't account for the whole phenomenon.
All right, that leaves the psychological stuff. I've heard researchers talk about this idea of postponement of death. The idea that someone, maybe unconsciously, just holds on until after a big milestone, like Christmas, and then they let go.
That's one theory for sure. And emotional stress is another, the pressure of travel, tricky family dynamics, all of that. But again, the data complicates this really neat kind of beautiful narrative. And this is where the Alzheimer's patients come into the picture.
Okay, explain that. Why look specifically at patients with Alzheimer's?
Well, the researchers hypothesized that if this death spike was being driven by a conscious desire to, postpone death, or by the psychological stress of the holiday, then patients who have Alzheimer's, who are presumably less cognitively aware of the date or the social meaning of Christmas, they should show a smaller spike. Or maybe no spike at all.
Because they're less able to consciously hold on. It's like a natural experiment on awareness.
Exactly, but what they actually found was that the mortality peak for cardiac patients who also had Alzheimer's listed as a secondary cause was, in fact, slightly larger than the cardiac peak alone.
Larger.
Slightly larger. It strongly suggests that a conscious desire to postpone death, or even the awareness of holiday stress, is not the main engine behind this massive excess mortality. We have to look somewhere else. And this brings us to the core finding. It's the most compelling behavior-based explanation that's supported by the numbers. It's the lethal cost of inappropriate delays in seeking medical treatment.
The cost of inconvenience. We already have research showing that urgent care admissions drop, like way down on Christmas Day, New Year's Day, and then they spike right after people are waiting. So the big question was, is that waiting fatal?
And the data argues that, yes, it absolutely is. The data point that really acts as the smoking gun here is the mortality rate for what's called the DOA eat-out patient group.
Okay, let's just clarify that jargon for everyone listening. What exactly does that group represent?
So this is the group of people who died either before or right when they reached medical help. DOA means dead on arrival. ED means they died very rapidly in the emergency department. These are basically the deaths that happened before any real intervention could properly start. They were just too late.
And what was the spike for that specific group during the holiday period?
For this rapid death group, cardiac deaths were 4.65% higher than expected. But here's the really critical comparison. Non-cardiac natural causes, so things like respiratory infections, strokes, complications from diabetes, they spiked at almost the exact same level, 4.99% higher than expected.
Wait a minute. The non-cardiac spike is essentially identical to the cardiac spike. That's huge.
The correlation is extremely strong. They rise and fall together across the years. And this really proves that the problem isn't just a heart issue driven by cold or food. It's a shared, systemic, or behavioral cause that affects any serious natural medical event.
And the common denominator seems to be access or more likely, the willingness to seek help immediately.
Exactly.
So now contrast that 4.65% excess for the group who died before getting care with the patients who were already in the hospital.
Right. For those already receiving care, the inpatients, the cardiac holiday peak was much smaller. It was only 1.60% excess mortality.
That statistical difference is everything. If you compare the risk of dying before you're admitted to the risk of dying once you're inside the hospital system, the pre-admission risk is almost 3 times higher during the holidays.
It very clearly suggests the problem isn't about poor quality of care inside the hospital during the holiday. It's about the patient waiting too long outside the hospital.
That behavioral connection is it's everything here. Why do people wait? I mean, they don't want to disrupt the family gathering. Or maybe they're traveling and they don't know where to go for care. Or they're just trying to tough it out until the holiday's over. It's the lethal cost of social inconvenience.
And that one decision to just wait a few hours, or maybe a day, can literally be the difference between surviving a heart event with timely care and dying on arrival because the damage was just too far gone. And because the non-cardiac deaths show the exact same pattern, this behavioral risk applies across the board to any acute, serious health crisis during that 2-week window.
So what does this all mean for us now, heading into future holiday seasons? Is this risk just staying steady, or is this a problem that's actually getting worse?
Unfortunately, it's a worrying trend that's embedded in the data. The percentage excess of holiday mortality has actually been gradually increasing over the 26 years that were studied.
Give us the numbers on that. How fast is it accelerating?
Okay, so in the earliest 3 years of the data set, the excess mortality from the holiday effect was only about 0.95%. But by the latest 3 years they analyzed in the study, so the end of the 90s, early 2000s, that excess was up to 4.4%.
Wow. That's nearly a 5-fold increase in the strength of this risk factor. It suggests that whatever is driving this delay, whether it's social pressure, more travel, changes in healthcare, it has become a much, much stronger factor over time.
Yeah, it suggests that the societal pressure to maintain that holiday ideal to avoid disruption is only getting more intense.
And the researchers also brought up 2 other potential factors that might be interacting with this, right?
Yes, the first one was staffing changes. They speculated that, reduced medical staffing levels in hospitals during a major public holiday break might play a role, maybe reducing the availability of specialized treatment even if you do get admitted.
And the second factor was tied to travel.
Exactly. They noticed this interesting anomaly in the data. The only 2 years without a cardiac spike in the entire study were 1973 and 1981. And those years coincided with major reductions in U.S. travel, the OPEC embargo, and a big recession.
That's fascinating.
It really supports the idea that increased travel might contribute to this delay effect. Maybe by putting people far from their regular doctors, their familiar ERs, just increasing the friction to get help when symptoms start.
So here it is, the most practical, the most vital takeaway for you listening right now. If you or a loved one feel serious symptoms, cardiac or anything else, during that 2-week period from December 25th to January 7th, please remember this deep dive. Don't fall victim to the social pressure or the inconvenience of delaying care, because the evidence shows the decision is statistically significant and it is potentially fatal. It is so much better to disrupt a party than to end up as a statistic.
To summarize the core conclusion here, the Christmas and New Year's holiday season is an independent and growing risk factor for both cardiac and non-cardiac mortality. And this spike is primarily driven not by climate or bad food, but by a behavioral decision to delay essential medical treatment until the holiday is over.
Right. We've established the spike is overwhelmingly concentrated in that group outside the hospital, the people who died because they waited too long. But the study offered one final, really critical piece of data that goes beyond individual choices and points to a potential systemic failure.
That's right. They found that even patients already admitted to nursing facilities experienced a significant holiday mortality spike, a 3.72% excess.
And that is such fascinating data, because if the delay hypothesis mostly covers people outside the hospital making a choice to wait, what does that nursing home spike imply? These people are already in a controlled medical environment. They aren't choosing to tough it out at home with family.
It raises a really profound question about institutional processes during the festive break. A 3.72% excess mortality rate suggests the problem goes beyond personal choice. Does the spike imply resource rationing, reduced access to specialist doctors, a breakdown in critical care routines, and immediate attention when everyone else is on holiday? It suggests that the holiday effect may be a systemic challenge, perhaps impacting the quality or timeliness of care within our institutions, not just our individual decision-making. And that is a sobering thought to carry into the next holiday season.
And that's a wrap on this episode of MedDecode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.